Hi, everyone. This is my infant case study that I did on a 2-month-old. All right, so the case presentation, we have Jack, who is a 2-month-old male who presents for his 2-month well-check visit. Per his mother, Jack has been doing really well at home. He started cooing and smiling recently. He also right now is taking 6 to 8 ounces of formula at least 4 times a day, and then sometimes has up to 6 feedings. He is a formula-fed baby, not breastfed. His sleeping patterns are sporadic, but overall he sleeps pretty well throughout the day, and at nights usually waking 1 to 2 times for feedings. Currently, he has 6 to 8 wet diapers a day and around 3 stools. So his history. He has no known allergies to any medications or foods, and is not on any current medications. For family history, his father has hypertension. His mother has no remarkable history. His paternal grandfather has hypertension and hyperlipidemia, and paternal grandmother, maternal grandparents have unremarkable history as well. And all of these people are currently living still. Past medical history, his last check-in was at his 1-month-old visit. He was a vaginal birth with no complications. At birth, his APGAR score was 9, and the 1 point was for his appearance. His social history, he currently lives in a newly built home in 2017 with his mother, father, and 2-year-old brother. And his current immunizations are his first dose of Hep B. So for subjective data, general appears well and happy. Per mom, Jack coos and babbles at home all day and is happy. For his skin, mom denies any rashes or lesions. Neuro, he's acting normal, cooing, making noises, as I said. For his HENT, per mom, no drainage from his eyes, ears, or nose. There's no sign of ear pain per mom. He is starting to hold his head up more each day. Respiratory, she denies any shortness of breath, any labored breathing for Jack, and she also denies any blue spells or signs of cyanosis. First, more subjective data, GI, mom says there's normal stools roughly 3 times a day. They're soft, and she denies any vomiting or spitting up abnormally. GU says there's normal elimination pattern, 6 to 8 wet diapers a day. For his musculoskeletal, according to mom, he tolerates tummy time. He's spending more time on it each day. He's starting to hold his head up a few minutes a day, and he moves all extremities. And mom also states he's very happy at home right now. Moving on to the objective data. So we have his general appearance, his weight, he's 12 pounds, 5 ounces. His height is 24.5 inches. His current head circumference is 15.4 inches. Off to the right, we have the percentile. So he's moving in the right percentile, gaining his weight back from birth, and he's moving right along. For vital signs, we have his respiratory rate of 42, heart rate of 146, and temperature of 97.9, all within the normal range for a 2-month-old. So now the objective data for his skin. He has normal pigmentation. His skin is warm and dry, normal skin turgor. There's no lesions present, and his skin is smooth. For cap refill, it is less than 3 seconds. His nail beds are pink, no clubbing or deformities present. His head is normal cephalic, no lesions, lumps, or tenderness present. Posterior fontanelle is closed. The anterior fontanelle is still open, and his face is symmetrical. For eyes, his eyes are symmetrical. Eyelids, eyelashes, eyebrows, sclera, and conjunctiva are white, and there is a red light reflex present on assessment. His ears, his skin is intact. There's no lesions or masses, no discharge present. His tympanic membrane's pearly gray and intact. There's no bulging or erythema present. For his nose, symmetrical, no lesions, no discharge or deformities. His nostrils are patent bilaterally with no obstruction. His terpenates are pink and moist, and his septum is midline. His mouth, his lips are symmetrical, no lesions, no teeth present at the time. His gums and mucosa are pink and moist. No tongue coating, it's smooth and pink, and his uvula rise to midline when he started crying during the assessment. For cardiac, he has no heaves, thrills, or pulsations, no masses. His PMI is palpated at the 4th intercostal midclavicular. His heart rate's 146 with a regular rate and rhythm. S1 and S2 are present, and there's no S3 or S4 sounds. Also, no murmurs noted on assessment. Respiratory, no labored breathing. He has slight belly breathing still, but that's normal in 2 months, and it will decrease as he gets older. His respirations are 42. He has no lumps on his chest, no masses or lesions present. His chest expansion is symmetrical, and his lungs are cleared auscultation bilaterally with no adventitious lung sounds. Moving on to musculoskeletal, normal movement and passive range of motion. His movements are smooth. There's no asymmetric joints or muscles, no swelling, deformities, or masses, no crepitus present. All his pulses, brachial, radial, femoral, dorsalis, pedis, and posterior tib are normal, +2. Normal muscle tone and strength for his age. He also has a negative Ortolani test as well. Neuro, he's appropriate cooing, babbling in the office. His GI and GU, abdomen is soft and symmetrical, no masses or lesions present. Palpated his liver and spleen, there's no swelling. Active bowel sounds in all 4 quadrants. For his genitalia, his testes are just descended bilaterally, no lumps or masses, and the symptomatic reflex is present. For development, he begins to grasp toys. He has a decreased head lag when he picks up his head or you pick him up. He's following toys side to side with his head. He's smiling, he's cooing, he's vocalizing to familiar voices now. He's moving all his extremities and increasing tummy time with supervision. He can also hold his head up while on his stomach and begins to slightly push up. Off to the right, I included a tummy time duration. So he's currently 2 months, so he should be getting 20 to 30 minutes. By the time he turns 3, he should be getting up to an hour. So for immunizations, today, while he's here in the office, he's going to get a 2nd dose of Hep B. He's going to get the rotavirus. He's going to get DTaP, the inactivated polio, the pneumococcal conjugate, and the Haemophilus influenza type B. This is just a chart off to the right, noting when he will get his next vaccines and the chart just as he gets older. Moving on to safety. So this is a big thing, especially for new parents, and also a reminder for any parent. At this age, he needs to be back to sleep, nothing in the crib at all, no pillows, no sheets, no toys. It can increase the risk of SIDS. You also never want to leave the baby unattended, especially on a changing table. They do start to move at this age a little bit, and he could roll off. You also don't want to have any smoking around the infant. Do not microwave formula as it could burn. No solids should be offered at this age. If he does appear hungry and he has already eaten, you can offer a pacifier. You can also give this to him while he's going to nap, and this can also help prevent SIDS because they will suck on it. And lastly, we want to make sure there's limited sun exposure and the use of SPF sunscreen. So for differential diagnosis, we have a 2-month-old well-appearing male child without any abnormal findings. While we're here, we also want to assess mom for postpartum depression. This is one of the screenings. We also would want her to contact us for any vision or hearing abnormalities, and a screening can be done for that as well at this age. And lastly, he's going to have preventative immunizations in the office today. So the medical diagnoses are the same, followed with the ICD-10 codes. Moving on to the questions. So we have question 1. The mother asks if her baby will have a hearing and vision screen today in the office. Your best response is A, yes, it is routine. We test it every well check during first year of life. B, no, he will not today. If he was not reaching milestones such as turning to a familiar voice or being vocal when hearing people, or not looking at bright objects or colors, then hearing and vision screening would be completed. C, no, he will have it done at 6 months. Or D, yes, he showed abnormal development in his assessment. So the correct answer for this is no, he will not have it done today. If he was not reaching any milestones or they were delayed and he should have been reaching them, then a hearing and vision screening would be completed. So for question 2, we have during the 2-month well check, mom wants to know why her baby needs 6 vaccines and if she can put them off. As a PNP, your best response is A, yes, he needs them to help prevent contracting deadly viruses that can potentially lead to death. And no, you cannot delay them. B, you can put them off. No need to get them today, maybe another day. C, you can delay vaccination, but it's not advised by providers and you can potentially contract a deadly illness if not vaccinated. If delayed, there's a protocol for how to finish his vaccinations in a timely manner on the catch-up schedule. Or D, you don't need to vaccinate. There's no reason for them and they don't help him at all. So the correct answer is C, you can delay vaccination. It is not advised by any provider because the baby could contract a deadly illness if not vaccinated. If they do choose to delay it though, they can follow a catch-up schedule and that way they can still finish their vaccines on time. And lastly, we have the references. I hope you enjoyed my presentation.